I want to come back to another point in the Stress in America survey of this year about the sources of stress in people's lives. 75% say it's money. 70% say it's work. The economy, of course, comes up, obviously linked to the money question, 67%. Relationships, 58%. Family responsibilities, 57%. Any surprises there to you, Dr. Anderson? Particularly, we were talking earlier about the sort of anomalous results of the stress levels seem to be going down, even though the economy is still in quite a state. Would this be the results you'd expect at this point?
Well, I'm sorry to say these are expected because previous surveys and the years we've done this have shown pretty much the same thing, that the kinds of things that cause people excessive, extreme stress tend to be the same year to year, and they cluster around economic factors, work, the economy, are really the things that give people most concern, followed by another, what looks like more interpersonal cluster, relationships. In the family caregiver issue comes up. Relationships with family members can be a source of stress for many.
And I think the other piece is how many people are stressed over health issues.
Yes.
Not just the caregivers dealing with people that are sick, but people that have their own health issues. Over half of the people said that was a major stress.
Yes.
So it's sort of the economic piece, the relationship piece, and the health piece. And I'm not sure that that many Americans actually appreciate the health piece. I think the economic and the relationship piece might not surprise them, but the health piece might.
Well, and obviously there are going to be a lot of people for whom all of these are overlapping issues, right?
Yes,
stressed
definitely.
about the economy, and you also happen to have a chronic illness with the rates of chronic illness.
And they are also interactive, so that, as Dr. Johnson mentioned earlier, having a chronic illness is a stressor in and of itself. If it impairs your ability to function in your marriage or in your parenting or in other important relationships, that adds to the stress. If you can't work, that adds to the economic stress. The stress then of the economics and the impaired relationships adds to your disease burden. So it can be a really vicious snowballing kind of cycle where all of these things can play off of each other. Our relationships are what we turn to for support. So if our relationships begin to erode because of arguments about finances in the house, or you can't do this for your kid, or create more of your inability because of your then physical disorder to be able, as I said, to meet important roles, it's very additive and really does set people up for some really bad health outcomes.
Now, all of this has to be adding up to a lot of cost. And we know that chronic illnesses are about 75% of total U.S. health spending. If what I'm hearing basically suggests that there's a major role of stress in all of this, it's a big, significant number, I assume, Dr. Johnson.
Well, yes, and I guess what I was sort of saying before, and I'd love to say again, is that to me what's sad is that we actually know how to help people manage stress. We actually know how to help people lead healthier lives. But somehow our healthcare system is not focusing on that. It's sort of waiting till everybody is sick, and then it's handing out all kinds of biomedical interventions to help you with your disease. So what are we left with? We're left with more and more people that are getting chronic illnesses, in my view, unnecessarily, and increasing healthcare costs. So until we actually start focusing on stress and behavior, I don't see any change in the increasing amount of chronic illness in this country, and I don't see any change in the increasing cost of healthcare in this country.
Yeah, because if you just, as Dr. Johnson said, 75% of healthcare costs associated with chronic illnesses. What's driving the chronic illnesses? Stress is a major driver of the chronic illnesses. Unhealthy behaviors are major drivers of the chronic illnesses, but we are, in our healthcare system, are obsessed with treating the chronic illnesses rather than backing up a step, focusing on prevention, focusing on lifestyle change, focusing on stress management to help prevent people from developing these devastating illnesses.
All right, so let's talk a bit about what we might need to do then. Most people are, if they're lucky and have health coverage, accessing primary care. What do we need to do to bring more of the behavioral care into primary care at this point, Dr. Anderson?
Well, one of the things that we are excited about is really the potential with healthcare reform to make some of these changes. It's going to take a lot of work. But one of the movements that we've been participating in and are very excited about is this whole team-based care, where patients don't just see a single physician, a primary care doctor, for example, but when they go to a physician's office, they're actually seen by a team of health professionals, including psychologists, nurse practitioners, social workers, others, that really focus on what we've been talking about earlier, that chronic illness, treatment and prevention really requires a holistic approach where we're just not focusing on the biological aspects of it, which are important and giving appeal for that, but we're focusing on things like stress and lifestyle management. So this team-based care is really the wave of the future, but we have to make sure that the appropriate payment models are in place, the appropriate incentives are in place, so we can make that a reality.
We hear a lot of the phrase patient-centered medical home, for example. It sounds like you're saying, in effect, you got to have people who are comfortable and professional in dealing with behavioral health issues right at the table, right there in the patient-centered medical home environment, correct?
That's exactly right. And as Dr. Anderson said, we're certainly very supportive of that concept of health care, realizing that you have to treat the whole person. And treating the illness after it's developed and chronic is not a way to drive down healthcare costs in this country at all. The good news with the Affordable Care Act is that beginning in 2014, we're going to have 32 million more Americans who are going to be covered with some sort of health insurance program, whether it's through Medicaid expansion or the health insurance exchanges. That may be part of the reason we've had so many uninsured persons in this country that folks don't go to the doctor until they are absolutely desperate or are so sick that they're way down the road with their illness. So I think with the new focus on the patient-centered medical home, more focus on prevention, more reimbursement for screening for things like depression and obesity, a more team-based approach to care so that we're treating the whole person and not just treating a disease, has the potential to have a very positive impact in the long term.
So, Jonathan, how did the community support things that you all have been doing ring themselves around the patient-centered medical home to provide that additional support?
Yeah, that's a great question. I mean, we're very encouraged by the concept of the patient-centered medical home. I think the challenge is the traditional healthcare environment doesn't see community-based organizations as legitimate players necessarily in the health space. And yet we know the Y and other community-based providers can get outstanding results on lots of different metrics, but that we meaning the community-based organizations, need to be part and parcel of that team of folks who are helping the individual. I mean, a doctor has, I think it's 8 to 12 minutes to spend with an individual. When a person comes to our diabetes prevention program, for example, we have them for at least 16 weeks, and they're in a group format. So shortening that community to clinic gap is, I think, one of the challenges that we are wrestling with right now, but see great hope for the future.
Now, you spoke earlier about the Y focusing more and more on health-seeking individuals, particularly also focusing on individuals who, as you said, don't necessarily have access to health clubs. It's some lower-income people. How do people with low or even minimal incomes access the services you all provide? Sure.
Well, some of the programs that we offer are no cost, or they're being subsidized by others. And all YMCAs engage in local fundraising. That's one of the benefits of working with community-based organizations. They can bring other resources to the table. And Y scholarship individuals who don't have the ability to pay for perhaps a program, and they can be part and parcel of a program just like everybody else. And I do think that's a virtue of community-based organizations, that when you're dealing with a government program, you either qualify or not, period, the end. There's no additional support. Community-based organizations can leverage other resources, public and private, to help those individuals who don't have the ability to pay.
So if I'm a low-income obese person with diabetes just feeling enormous stress because of my illness, and we know diabetes is an incredible stressful illness to have, how do I get to the Y? How do I access those services?
You go to the YMCA and say, I want to participate in this program. I think it would be wonderful for me, and the local Ys will work and do everything possible to engage you in those programs. So, yeah, we have an open door policy.
So let's come back again to this group of people, caregivers, who are dealing with many elderly relatives in many cases. Also, we know younger people can experience high levels of disability, and there are lots of caregivers taking care of younger people as well. These results showing this decided difference in the stress levels really are troubling when you think about the fact that there really aren't a lot of sources of support for caregivers in this country. There aren't a lot of respite care programs. There aren't a lot of avenues for them to relieve their stress. What do we need to do from a policy level about that, Dr. Johnson?
Well, I think that a couple of things to keep in mind is this caregiver stress issue is only going to get worse. With the baby boomer generation, of which I am a member, getting older, we're going to have more and more older people who have very high rates of chronic illness needing care. And that generation is also going to be providing care. It's like we call them the sandwich generation. They're not only going to be facing their own illnesses, but their parents' illnesses, sometimes their children's illnesses. So we're going to see more of this as a problem. In my experience, what happens is when you go into the healthcare system, the focus is always on the person with the illness. Of course, that's important. But it's as if no one bothers to ask the caregiver anything. And that's what we are arguing here or trying to advocate for, is a healthcare system that looks not at the whole person, but really, in this case, the whole family. If you don't take care of that caregiver, healthcare costs are going to escalate astronomically because you won't be able to keep that person in the home. They will have to go to some sort of facility, which will cost all this kind of money. So it's just another good example of needing a healthcare system that focuses on people rather than diseases.
So how would we do that? How would we structure that, Dr. Anderson?
Well, one of the things that I think that we're getting at is the healthcare system really needs to be structured to take into account all of the potential risk factors, all the demonstrated risk factors for illness. So if we do that, yes, we are focusing on biological assessments, but we also have to ask people about the stress in their lives. We have to ask them about their diet, their nutrition, whether they're exercising. And we need to ask them about family relationships, what's going on in the family. So a person could have an opening to say, well, I've been taking care of my relative who has this chronic illness. That should be a clue, a cue, if you will, for a physician to think, well, this is a risk factor. They know the data. It's evidence-based medicine. They know what the data are and what the data say, and that should be a cue to tie that person to appropriate services. Again, if it's team-based care, then there's someone on the team who may be able to assist the caregiver, a psychologist, social worker, nurse practitioner, or another.
Well, again, as the survey indicates, this high level of stress, decidedly higher level of stress for caregivers, is mirrored by the higher level of stress for those with obesity. And let's come back to that topic as well. Again, with the amazing rise in obesity in this country, and the degree to which we're going to have to get serious as a country really fast, we know that one of the most important things we're going to have to do is lifestyle interventions. But those are hard. It's hard for people to change behavior. We all know this. We all struggle with this. How can psychologists and others who focus on the behavioral aspects of care be better utilized in that process, not just only of addressing the stress that is felt by those with obesity, but encouraging them to integrate the stress into their lives in such a way that they can make the kind of behavioral changes that are needed? Dr. Nordahl.
I think it's important that, again, back to these healthcare teams,